Set up in 1998, the Institute is jointly funded by the Departments of Health in Ireland and Northern Ireland. Our key priorities are promoting health and well-being, improving health equity, reducing health inequalities. We work to achieve these by focusing on evidence, policy, partnership. The Institute has a team of public health and policy development specialists based in Dublin and Belfast and undertakes work across the island, working towards healthier populations. Visit publichealth.ie for more information.
Welcome back. I am delighted to be chairing this panel session on measuring the cross-border impacts of healthy cooperation, and to have four panellists who are ideally placed to give us some insights on the overarching issue we are exploring here now. This panel session is part of the Centre for Cross-Border Studies project Time to Measure Cross-Border Impacts, Building Sustainable North-South Relationships and Connections, which was made possible by the generous support of the Department of Foreign Affairs Reconciliation Fund. The rationale behind this project was to use two practical examples: the proposed European Commission directive on ending seasonal time changes and the introduction of public health measures and supports to address the coronavirus pandemic, to demonstrate the potential benefits of undertaking cross-border impact assessments of proposed policies or legislation from a cross-border perspective. Over the course of this project, we have undertaken workshops, surveys and interviews with key stakeholders and officials in both jurisdictions on the island of Ireland to get a more in-depth understanding of how they have experienced the introduction of new measures and regulations to address COVID-19, as well as what they would consider to be the potential impacts of the introduction of a time difference between Northern Ireland and the Republic of Ireland during part of the year. Brexit has undoubtedly demonstrated the urgent need for cross-border impact assessment, or border proofing, of proposed legislation and policy, assessing its impact on North-South cooperation and on our ability to capture the full potential of the communities living and working on this island. To tease out some of these issues and their implications, we have four excellent panellists. Maureen O'Reilly is an independent economist and a senior research associate with the Centre for Cross-Border Studies, having previously been senior research economist with the Economic Research Institute for Northern Ireland, and having headed up before that the Policy Evaluation Unit at the Northern Ireland Economic Research Centre. Maureen has led on most of the research undertaken as part of the Centre for Cross-Border Studies Time to Measure Cross-Border Impacts project, and she will be discussing that work shortly. Aidan O'Kane is the Vice President of the Londonderry Chamber of Commerce, as well as a Director at Allstate Northern Ireland, a company that employs 2,400 people across Northern Ireland, including Belfast, Derry and Strabane. Of particular relevance for today, Aidan is also co-chair of the Cross-Border Workers Coalition, an alliance of individual employees who are resident in the Republic of Ireland but work in Northern Ireland, and businesses who are concerned about the impact of restrictive cross-border tax legislation. The group was established in March 2020 and originates from the Northwest. Helen McAvoy, who joins us online, graduated from Trinity College Dublin with a primary medical degree in 1997 and worked for several years in both hospital and general practice. She completed her MD in 2000 as part of the Masters in Health Promotion Programme NUI Galway. Helen has worked on a number of government programmes relating to ageing and older people, and she is now working as Director of Policy with the Institute of Public Health, focusing on progressing the government's health inequality agenda in Ireland and Northern Ireland. In this role, she has contributed to a number of reports and policy papers on inequalities in maternal and child health, fuel poverty, tobacco, alcohol, and inequalities in the border region. Today, Helen will be drawing on the all-Ireland work of the Institute of Public Health and considering the potential benefits of North-South cooperation. Anne Nolan is also joining us online, is an assistant professor in global health in Trinity College Dublin and director of both the MSc in global health and the Trinity Centre for Global Health in the School of Medicine. She is technical specialist in HIV and sexual health with research interests in the politics of public health, the transnational dimensions of health and inclusion health. Anne is a former executive director and chairperson of HIV Ireland Limited and has led the development of global policy frameworks for adolescents and most at-risk young people with UNICEF and UNAIDS. Today, she will be looking at the politics of COVID-19 on the island of Ireland. You are all very welcome today. Thank you very much. And I'm going to ask Maureen O'Reilly to make the first presentation. So over to you, Maureen. Thank you.
Thank you, Anthony, and thank you to the Centre for CrossBorder Studies for inviting me along today and for being involved with the project as well. As Anthony said, today I'm going to talk about the impact of COVID legislation and our policy and cross-border integration. And whenever we discussed this project, we tried to think of where, did we see it matter most in terms of the implications of legislation connected to COVID and how it impacted on cross-border activity, and obviously cross-border workers in the Republic of Ireland and Northern Ireland sprung to mind because they were particularly badly affected by some of the decisions that were made. So just in terms of the what this is all about, making sure that the border works is critical in terms of benefiting communities at the border, but even more widely, businesses, employees, and how they go about basically living and working. So what this project really aims to do is to promote a more informed discussion on the need for border proofing of legislation and policy, that's actually taken into account whenever we look at new legislation that's brought into play. So that means understanding how decisions, and particularly those legislative changes made by the Irish, the British, the Northern Ireland governments along with the EU, impact on cross-border integration. That impact in terms of north, south, east, west cooperation and our ability to capture the full potential of communities living and working on these islands. And as I said, the impetus here, just considering in more depth the issues that have emerged for cross-border workers as they've navigated the complexities of decisions taking during the pandemic crisis and working and living across either jurisdiction. And just to set that in context, every day an estimated 30,000 people cross the border between the south of Ireland and the north to work. So we have consulted with many key stakeholders as part of the project. That's the advice centres, businesses, the government itself, cross-border workers, to try and understand and to find ways to acknowledge that those decisions actually make a difference to how they live and work. So COVID has shone a light on the impact of legislation and policy for cross-border workers, and it's actually unearthed hidden complexities that were probably there but weren't really taken into account because they happened by default. But what you did have in terms of COVID was these very diverging approaches and measures to basically deal with the pandemic in the two jurisdictions around public health measures and supports. And that includes the physical access to work, the support schemes, simple things around how you define a key worker, the time and extent of the lockdowns, and the time and extent actually of the vaccination programmes as well. So that's been interesting to watch. And I know from a piece of work I did with the centre at the very outset, even watching the business supports and the different approaches taken to that at the very outset showed that divergence. What we ended up having was a lack of information and really confusion at the outset. And I know that a lot of that was understandable in the context of how quickly the pandemic came to light, but not all. And what you ended up with was this lack of joined up response. And that had significant challenges in understanding what rules and supports applied for cross-border workers, for the employers, for the advice centres as well. So in terms of the issues, so a number of issues were brought to the fore in terms of challenging that concept. I mean, there is a common travel area, there's freedom of movement of workers, but there were challenges to that in terms of some being transitory, just in terms of just dealing with the pandemic, but others more lasting as well. I mean, arguably one of the biggest market failures generally in government policy and legislation is the whole concept of, information failure, that someone knows something, but others don't, and then they don't know how to work, with it. And COVID really did shine a light on that significant failure in the design and dissemination of information regarding the legislation and policy in areas such as the medical issues, the right to travel, employment rights, tax, welfare. And what you had was quite a lot of misinformation and confusion, which was evident, and social media picked up on a lot of that as well, and in itself, can create problems in that respect. But another particularly important issue that emerged was that around the tax and welfare implications. And again, this COVID brought this to the fore. One particular example is a pandemic unemployment payment, and I know just from obviously the survey with some of the cross-border workers, it's a particular source of stress, the fact that the pandemic unemployment payment, €350 a week, that was introduced in the Republic of Ireland. It was actually linked to residents. That meant that workers in Northern Ireland who were made redundant, and even the self-employed, couldn't access a pandemic scheme. So you had this situation where workers in the south, living and working in the south, could access the PUP. Workers in the north couldn't, and that was relying on EU employment rules. It is an issue because the pandemic unemployment payment effectively provided a source of basic income in the south, and that wasn't the case in the north, where universal credit kicked in. There were tax implications in terms of not being a tax resident for a required number of days because of the travel restrictions. It was a source of stress for many, and the whole concept of double tax and home working really came to the fore. And I won't go into any detail on that because Aidan obviously will cover that in terms of the work he's doing. And just a small quote, from one of the feedback from some of the key stakeholders. Cross-border workers should have the right to work from home when their job allows, without any additional tax liability. And there are examples even of not being well, and it's better just to, even though you could arguably work at home, you're better just being sick because that it just causes too many problems. And then what we ended up with was really a strong sense of frustration around the value placed on the role of cross-border workers, and they obviously saw this with the development of the Cross-Border Workers Coalition. The right to travel to work, there was confusion and lack of clarity on that. It was interestingly, one kind of stakeholder consultee talked about one side being treated differently to the other, which is very unhelpful in terms of trying to promote the whole concept of working cross-border. And direct impacts as well. I know that one consultee, a business, talked about the fact that a trainee couldn't cross the border to undertake training with his colleagues, and obviously then fell behind in terms of that training. So that's another example of that aspect of the right to travel to work. There was uncertainty as to who is a key worker and how that was interpreted differently. And what was really interesting there was there's actually almost a fear among some of the consultees, the cross-border workers, around whether they had the right letter, whether they would be stopped by the PSNI or the guards, and what that would mean in terms of basically what their rights were as a cross-border worker. And the support schemes as well, trying to understand who could access the support schemes. Just a very small case in point, but important for them. Someone who was working in the north signed up to a job in the south, or just resigned from a job in the south because they were taking up a role in the north, and they actually weren't entitled to the furlough scheme. So they found themselves in no man's land in terms of where supports could come from. And just some examples. These are sound bites from actual cross-border workers, and you can see the sense of frustration in terms of what they had to try and deal with. I was unsure if I would be looking at Irish or British regulations and couldn't find a joined-up response. As a key worker, I find the ability to work cross-border very complicated. Cross-border workers would be asked to return to work in one jurisdiction when travel restrictions were still in place in the one they lived in. The word hassle came up frequently. Being a remote worker, I wasn't able to continue working cross-border and may have to look for a job. So the survey was in the middle of that there were still some restrictions in place, and people who failed to meet benefit criteria as a cross-border worker in both jurisdictions felt very let down. So just some examples, tangible examples of where it impacted. So what it really suggests is that it is important to consider the challenges and risks before policy or legislation is introduced, and I think this is really critical. Again, COVID did raise issues because things had to be done quickly, but that doesn't mean that they still can't be done well or considered in some respect in terms of the challenges of being a cross-border worker and an employer of cross-border workers as well. So typically what happens is there are challenges and barriers that arise because there's a lack of evaluation of the practicalities of introducing legislation and policy, and that's basically is because then that tends to be an ex post tackling of barriers. So these policies and legislations typically aren't thought through, and this is obviously coming from the perspective of cross-border workers. So it's looked at after the event when it's arguably too late rather than before it actually happens. Whereas in effect, if you did do some ex-ante mapping of the effects through some kind of cross-border impact assessment with experts from the border region and others, it means that the practicalities and challenges can be worked through in advance and mitigated or addressed as required, and obviously that makes common sense for government legislation and policies being introduced. Just to give an example, border proofing it's recently been introduced in the Netherlands. Anthony was very sorted out a workshop, and it involved Martin Unfried from the Institute for Transnational and Euro-Regional Cross-Border Cooperation, called ITEM, and he's done a lot of work on cross-border mobility and cooperation, and since 2020 it's now mandatory actually to undertake border proofing in the Netherlands, and that was actually driven by the politicians largely based in the border regions. So in effect now legislation and policies that's introduced where relevant has to look at the border effects. It's important to point out that the streaming element of that is really key, that the first step is to make sure that it actually might have border impacts, so it's not like everything has to go through this border proofing. It's for those areas that are relevant in legislation or policy. And the kinds of border proofing dimensions that it looks at are things like discrimination for citizens, the socioeconomic development of a region, does it disadvantage border areas, and the whole concept of cross-border cooperation, because it does work well whenever and for the betterment of people and businesses and government when it's done properly. And they also actually thought it was interesting they had a measurement system in place. So they actually tried to measure, or are going to try to measure, the impact of the policy through things like the number of cross-border workers, the quality of the cross-border employment services, and even just understanding the socioeconomic profiling of a region in terms of any policy response that's undertaken. But Martin was keen to stress that, you know, it's obviously early days in the policy. It's a new policy. There are challenges. I mean, one of the things I thought was quite interesting, you said that, you know, the policy worked arguably for the border, but when it came to cross-border, that's where the challenges started to kick in, because what you did need was agreement with the other border countries, and in their case, Germany and Belgium, for example, to look at this on a cross-border basis. So you had to get the jurisdictions involved. There are still complexities in tax and social security because they're national systems, not necessarily always harmonised with the EU. The administrative burden, which is a really interesting one, that there might be political will, but there isn't necessarily the kind of government will in terms of the practicalities of putting something like this in place. So can we border-proof legislation and policy? Just to consider the options, and I know it's something that we have been looking at in detail. Should there be an explicit border-proofing policy that should jurisdictions? That's something that would be again written into mandatory, so it would be in legislation in itself. It does raise issues around the extent of the administration, the political will, you know, the delivery buy-in. All of those things would need to be considered. As part of other proofing policies, I know something that we've discussed in detail at recent workshop was the whole concept of rural proofing, and obviously in Ireland with the New Rural Needs, the Rural Needs Act in Northern Ireland, and obviously the New Rural Policy in the Republic of Ireland. So there is rural proofing in Northern Ireland. It is in development in the Republic of Ireland, but the feedback was that first and foremost, if it's a rural proofing policy, the rural proofing aspect comes first. And what, in terms of introducing another layer in terms of border proofing those policies, there is the potential to be competing with other themes like environment and equality, and a feeling of assessment or fatigue was a concern. And it's quite interesting because I think the agreement was that even trying to introduce something like rural proofing policy was a challenge in itself, never mind bringing in something else. But what was really constructive and positive was the fact that, you know, there was a general agreement with it was programme or project-based approach. It made sense, and there are already positive exemplars. And it was interesting because I know in the when we had the workshop, lots of examples came to the fore where it already exists in terms of local collaboration and issues in common. You know, the health impact assessments, climate change, public employment surveys, children's heart surgery, you know, the Water Framework Directive. So there actually are really good exemplars of where border proofing actually takes place, but it's more from the bottom up than it is obviously from the top down. But I think one of the key takeaways from that is that regardless, if you have a good streaming system in place and you're only looking at policies that are at risk of having a negative impact or otherwise on the whole concept of cross-border cooperation, then that's where you need to look at first. And just finally, in terms of the, you know, how you might go about that, in terms of impact assessment and looking at that relevant legislation and policy and where it matters for cross-border cooperation. The Centre for Cross-Border Studies already actually has developed an impact assessment toolkit for cross-border cooperation to see where there are implications for cross-border cooperation in terms of any legislation, and that takes an ex-ante approach. So it looks at the policy beforehand, it looks at the economic, the social, the environmental, the governance, cooperation impacts of proposed policy and legislation. And what I thought was interesting just to end with was, if that kind of approach was taken into consideration, then if you think of the new existing and new COVID legislation that, you know, has precipitated a lot of kind of concern amongst cross-border workers, to the extent that some of that again could have been mitigated against. I mean, one of the things that I took away from this piece of work so far is the commentary from both employers and employees who are cross-border workers. You know, is it worth the risk and the hassle? What we have is a number of cross-border workers and employers who said that COVID had made them think that it simply isn't worth the stress and uncertainty to either work or to employ people on a cross-border basis. So, you know, there's obviously significant economic implications for that in terms of access to skills and jobs, and even a sense of community and being able to cross the border to again live and work. And this could arguably start changing behaviours, and I know that from speaking to some employers, I did get a sense that some may be more focused on in-country recruitment going forward. And again, an increasing issue coming up is this whole issue of running a payroll in the other jurisdiction and the implications for that. So that's something that could change behaviours, which would be really challenging. Although again, one employer did say that they are actively looking at ways to retain southern employees. This is a northern-based employer, but mentioned that if they ran an Irish payroll, you run into issues around access to the National Health Service. So there are, you know, in terms of the tax and welfare implications, those things all need to be checked through first, and that's where this kind of ex-ante assessment would kick in. And even things like an upsurge in people from Great Britain, so expats from Ireland coming home to live in Great Britain or to live in Ireland but still work in Great Britain. There's some feedback to say that they couldn't get their national insurance records working. So that whole concept again of free movement is challenged. I'll leave you with a couple of quotes in the bottom, which shows just a very tangible impact for people whenever these policies aren't thought through properly. And I'd just like to end by thanking Anthony, but also Anne-Marie O'Kane, who's the manager of the Border and People Project with the Centre for Cross-Border Studies, who's been has a great wealth of information on the issues because she had to deal with them first hand as part of the Border People Project over the last 18 months. So thank you.
Thank you very much, Maureen. A lot there to think about. And we'll come back to those in a moment, because we'll reserve questions and discussion after all four presentations. But one of the things that struck me there was that your repeated reference to free movement. And obviously we're in a situation where due to the UK's departure from the EU, that concept of free movement is now slightly different in terms of where the UK and Northern Ireland fits in terms of that free movement of people and what that actually signifies, and also this question of definitions. Key worker, cross-border worker. What are these things, and ensuring that there is comparability between the jurisdictions in order to facilitate that aspect of cross-border working. But also then you mentioned it towards the middle, but then again at the end you talked about changing behaviours, and that is something that we are really concerned around, is the potential for increased reluctance for businesses to employ cross-border workers, for citizens to engaging in cross-border employment because of that uncertainty, potential uncertainty moving forward. So thank you, Maureen. We'll come back to you, obviously, later on. But for now, I would like to ask Aidan O'Kane to take the stage, who will now perhaps drill down into some of these more specific aspects to do with cross-border working and perhaps the issues around taxation and remote working. So it's now my great pleasure to ask Aidan O'Kane to begin his presentation. So over to you, Aidan.
Thank you, Anthony, and thank you to the Centre for Cross-Border Studies for the kind invitation. It's my pleasure and honour to be here and present. So the Cross-Border Workers Coalition, who are they? So we're a coalition of individual employees and businesses that work in Northern Ireland but are resident in the Republic of Ireland. The group was established in March 2020, and that was right on the cusp of the pandemic, which really brought our issue that we're lobbying for to the fore. Our steering group is made up of many businesses representatives, for example, the Derry Chamber of Commerce, the Newry Chamber of Commerce. We've got business representatives from Allstate and from Seagate and some of the major FDIs that operate in and around the Derry area. The group has the support of some large industry bodies such as IBEC and CBI. So we have received a lot of support from these bodies, and we've also garnered support from the Oireachtas, Stormont and from Westminster. So our issue. Currently under the Irish tax, sorry, I'll just... Apologies. So under the current legislation, cross-border workers who live in the Republic of Ireland but work for Northern Ireland-based companies face a double taxation issue on the work that they do from their homes in the Republic of Ireland. Since the start of the pandemic, a temporary waiver was in place by the Irish government, recognising that there was an issue when we, as business owners, have asked our employees to work from home during the pandemic. In normal times, the TransBorder Workers Relief allows for Republic of Ireland domiciled employees to carry out their duties for Northern-based companies as long as the work duties are solely conducted within Northern Ireland. So you can understand the issue whenever it raises its head whenever we ask all of our employees to remote work. So it's got a very negative impact on the individuals. It also has a negative impact on businesses. We are not a large economy. Ireland, Northern Ireland, isn't a large country. We rely on drawing from the talent pool across both jurisdictions, and this is very prevalent in the Northwest, where dairy businesses look at their natural hinterland of Donegal, Sligo, Tyrone as being the talent pool where we draw our resources from. So the impact has significant personal and employer impacts. It's certainly from just a logistical perspective. From a logistical perspective, our employees have to make the journey in from their homes in Donegal into their office in Derry, and this just does not work for some of the modern jobs today, which requires 24/7 sort of involvement. From a technology perspective, from our company, we do rely on individuals to make themselves available at unsociable hours, and in real terms, we have seen in the past where employees have had to make a 30-mile journey a 60-mile round trip to come to the office to deal with issues which they could have dealt with for 5 minutes at their own kitchen table. The pandemic, as I say, has alleviated some of those concerns, but again, it's temporary. And this issue will come back really strongly at the end of this year if it isn't addressed full on by the Irish government and by the Department of Finance. The long-term solution to the issue will incentivise companies to take a look at the border regions for establishing their businesses. Companies, FDIs, do look at where they draw their talent from, whether their businesses can be sustained into the future in terms of access of talent and skills, which is #1 priority in terms of businesses ensuring they've got sustainability in particular regions. So having a barrier to draw upon talent is not going to lend itself very well for the all-island economy, which is talked about considerably. So our goals of the coalition. So until the end of this year, the temporary waiver is still in place for employees to be able to work from home, to be able to remote work for Northern Ireland-based companies. This comes to a stark end at the end of December, where our employees will face a cliff edge in terms of not knowing what their working arrangements may be. We are looking for a permanent solution to personal tax rules to accommodate the new way of working. Individuals, companies recognise that things have changed for good. The expectations of employees to be able to take advantage of remote working is in place and will not go away. So now is the right time to make a change and to address the issue which hinders that particular aspect for employees. We met with Minister Donoghue in June this year. It was a very open, positive discussion. He recognised that this was impactful. He recognised that it was an important issue to address, and he assured us that him and his department would give it all the attention that it quite clearly deserves. Ahead of those meetings, we engaged with experts from Grant Thornton to assist in stress testing some of our proposals, which we brought to the Minister in that meeting and his team. The advice that we were given was very coherent, and we had brought that to the table in terms of the tax strategy group. The Minister, on the back of that meeting, confirmed that he would be asking the tax strategy group to create a paper for this ahead of the autumn budget, which they did. So our legislative ask ahead of the January cliff edge is for the permanent solution to be put in place, introducing long-term pragmatic reforms into the tax system. The ideal outcome for us is, the bottom line, is the eradication of a tax liability for those that decide to work from home in ROI for Northern Ireland-based companies. A permanent continuation of the current waiver was also one of our proposals, and in conjunction with this, which is actually a very important aspect, is that the employer allowance in terms of removing requirements for things like shadow payroll, for example, is also a really important aspect to make the overall solution work. So the tax strategy group did produce a paper solely for our issue, which we were pleased about. The paper was released last Thursday, and it does address aspects of our campaign. However, it concluded that a permanent continuation of the waiver was impractical, and the document really did ignore the significant and pressing concerns expressed by the business community that operates in the border regions. In many ways, it was a paper that simply admired the problem. So we are in a position right now, as of this week, where we're putting together our proposal, We're putting together our proposal that will rebut the tax strategy group paper in a number of areas two key areas that we feel are the areas of concern is the equity piece, where there's concern from the revenue that there would be an imbalance in terms of individuals in Republic of Ireland having a particular advantage over another individual in the island. This doesn't take into consideration that there is currently an unlevel playing field between individuals that work for Republic of Ireland-based companies but live in Northern Ireland, who enjoy a 60-day flexible arrangement, if you like, where they can work for ROI-based companies and work from home in Northern Ireland. The other way just does not exist at the moment. So some key statistics, just if I can quote this, and this will not be lost in the audience, but 75% of border businesses employ staff from the other side of the border. And since the start of the pandemic, the number of remote working jobs has increased by almost 1,300%. And when we think about changing behaviours of businesses, this is a big concern. Just this week, we had seen an active advert for a job for a Northern Ireland-based company actually put in brackets behind the remote working conditions available for UK residents only. This is only the start of it. If something isn't done in terms of changing that type of situation that we're currently facing. We have had a lot of political engagement as well. So from a political perspective, we've talked to everybody there is to talk to from the Republic of Ireland across the full political spectrum, and we've had a lot of engagement there, and certainly they understand the issue and they understand the importance of the issue. So recently we had met with Sinn Féin Finance Minister Pearse Doherty, the SLP leader Colm Eastwood, Fine Gael Senator Emer Curry, who has been very sympathetic to our particular issue, and also the Sinn Féin President Mary Lou MacDonald. In regards to Shared Island Dialogue, this is one which we feel that the government in the Republic talk about a lot, and what concerns us is that when we talk about the all-island economy, a shared island unit, our rural future, those sorts of initiatives, although most welcome, absolutely, there are real and practical barriers to making those actually come to fruition. So, as I say, we've had a lot of political engagement. We've also had wider engagement within the business community, both north and south of the border. From IBEC, CBI, the Centre of CrossBorder Studies has also been a really strong advocate for our particular issue as well. So whilst we've had all the right engagement at this point, we're really now at the stage where action needs to happen, and we do call very strongly today that the Irish Finance Minister Paschal Donohoe takes a look at our issue and ahead of the autumn budget puts in practical measures to alleviate the concerns of individuals who are disadvantaged by this particular piece of legislation. Our recent media coverage has garnered a lot of traction as well as some of our social media aspects. So our next steps in relation to this is to bring forward, again, practical solutions to the Minister and to his department that will work for both businesses and for employees. It's a really important aspect to get right if we're going to take an all-island economy serious and if we're going to address issues that impact individuals and their lives. Again, our social media campaign has been very strong. I would encourage everybody to take a look at us on Twitter at Border Workers and get up to date with our current activity. We're really now at the stage where we do need to call on all individuals who are impacted by this to make their voice known, all businesses who have concerns about this also to make their voice known, and we can do that through our social media channels. And with that, I'd like to again thank Anthony for the invitation and for Anne-Marie as well for all the support in our particular campaign over the last number of months. Thank you.
Thank you so much, Aidan. Really highlighting here some of the real live issues in terms of some of the difficulties surrounding cross-border workers and cross-border employers as well, in terms of issues that actually were already there, but COVID has actually shone a light on some of these issues that were there, but now have become really pertinent. So thank you very much, Aidan. And again, we'll be coming back to you afterwards with some questions and about some discussion. It is now my enormous pleasure to welcome Helen McAvoy from the Institute of Public Health, who is joining us remotely. Helen, you're very, very welcome. I'm really grateful for you for being here, and to the Institute of Public Health, who have been great supporters of the Centre for Cross-Border Studies in our work, and obviously we admire your work as well. So it's absolutely fantastic that you're able to be here with us today. So I'm going to hand over to you, Helen, now. So whenever you're ready, just fire away. Okay, thanks, Helen.
Great. Okay, thanks so much, Anthony, and thank you very much for the invitation to contribute to this event today. Just to talk quickly about the Institute of Public Health, if we move on to the next slide, what we do, you will have seen a little bit of a video earlier. The Institute has been around since around 1997, 1998. We weren't one of the official implementation bodies set up under the Good Friday Agreement, but we do work on an all-island basis with funding from the Departments of Health in Ireland and Northern Ireland. We principally do this through developing research and evidence to support policy by influencing various stages of policy development cycle, from consultation, evidence review, development of policy, but also looking at policy implementation and policy review. And we work for governments, policymakers, and indeed civil society across the island. Our current strategic objectives are set out in this document here, which is available on our website. But Action 3 of our current strategic objectives really does digs down in particular on the north-south, east-west, and including the particular cross-border elements of our work, although it is in fact cross-cutting to all the other strategic objectives that we deliver. So next slide there. And I might just skip to the next one. So what am I going to cover today? Well, it's been a very interesting few years for public health on the island of Ireland, and globally, of course. I hope you weren't expecting me to talk too much about COVID-19. We have two other speakers that are going to talk about that in detail. I'm not going to talk about ways of coordinating healthcare services, and I'm not going to do the inevitable comparison of health status in Ireland and Northern Ireland. But what I wanted to talk about more broadly was how we can approach strategically improving population health on the island of Ireland, and how IPH works in that space. Talk in this honest way that we've been talking about a lot about honesty and being realistic on what are the current issues, and put forward perhaps some future possibilities, in the context of various different things in post-pandemic recovery, in the context of the UK's withdrawal from the EU, and all of those other contexts that are happening. Okay, next slide. So, if we think about health, I think a lot of people understand health in different ways. And maybe when we say public health, everyone's thinking primarily about the pandemic and control of infectious disease. But I've put in a quote here from Rudolf Virchow. This is a statue commemorating his life in Berlin. I'm not sure what the figures on the top are doing, but they're wrangling over political control over health. And there was a beautiful paper written in 2009 that really reflected on what he understood health to be. And I think that the key thing is that whole populations can be sick. The origins of those illnesses have their roots in social environmental conditions that are created by political action or inaction. And political action is needed to protect people from disease as well as to cure them. So if we take that idea of population health and what's needed to improve it, you will see just how closely politics and public health are related, and just how much politics is important in prevention as well as in providing care for people who are already experiencing illness and disease. And where we are at the moment is we're still in the grips of a pandemic of infectious disease, but we also have other epidemics in terms of obesity, the ongoing epidemic of tobacco-related disease, the epidemic of alcohol-related disease. Northern Ireland had the highest rate of alcohol-specific deaths in the UK for the first time this year. So there are other challenges here that are acting in a syndemic way when we have an infectious disease pandemic occur on top of the epidemics, which we're already dealing with on a long-term basis. Next slide, please. So what we do in the Institute of Public Health is we try and support policy development that is based on evidence. Sometimes we don't always have all the evidence we need, but that's based on objective evidence from Ireland, from Northern Ireland, and globally that encompasses health in all policies. So we influence policies in transport and education and social welfare that focus on health equity to provide everyone with an equal opportunity for health and well-being, that build policy that builds in all island, cross-border and north, south, east, west considerations beyond the lip service level. So what are the tangible tools and actions that can be put in place to support that to happen within strategy design, within its implementation, and indeed within processes of policy review? Linkages with European and global responses, because the main challenges to health status are European and global. And appropriate deployment of the tools of government for health improvement, be that regulation, investment in large-scale programs, and so on. The best use of economies of scale on the island of Ireland and UK-wide, and commitments to develop infrastructure that facilitates both that informal and formal contact in leadership roles. So the number of linkages and the strength of linkages are the two keys, the two key values in relation to integration. So this guy is kind of like the Institute is trying to water the roots of good policy development that takes into account these issues, but it's never a straight course. We sometimes go backwards as well as forwards, but we got to keep watering, and ultimately, hopefully, the weather improves, the conditions are good, and we go onwards and upwards. Next slide, please. So these areas here you may recognize as the areas that were set out as areas of cooperation under the Good Friday Agreement in 1998. And the way that we are increasingly working is certainly we seek to support good policy development in the health area, but we have really taken the view that it's equally important to address health within education, within transport, environment, and so on. So, for example, we would recently have submitted consultation responses in relation to environmental planning in Northern Ireland. We would have been very active in providing public health advice for policies relating to 20 miles per hour in Northern Ireland and 30 kilometres per hour in the south, influencing road safety strategies and so on. So we try and build health into all of these policies rather than just focus on health policy alone. Sometimes those developments are happening parallel in both jurisdictions. That's okay. We don't force one set way of doing things, but we take the best evidence and we say, this is what we think may work for Northern Ireland. This is what we think may work for Republic of Ireland. And here's some things we may need to really give careful consideration for in terms of those issues I've talked about before around impacts on the border area, efficiencies of scale, and what infrastructures may be needed to support. And in one area, for example, may be evaluation. So we introduced 20 miles per hour in one area or 30 kilometres per hour in the south. They're not actually completely the same. I won't go into imperial and metric, but there's important things that we can learn from each other in the implementation of those of the same policy in perhaps slightly different ways. So next slide. So I've just sometimes it may seem a bit high level and abstract, but I thought I'd give a kind of a worked example of one way in which we would have supported North-South cooperation on alcohol policy. So the North-South Alcohol Policy Advisory Group was established by the Chief Medical Officers on foot of a recommendation that was made within a government policy in one jurisdiction, not in both, interestingly. But we have been facilitating the development of this group since about 2013. We run on a 3-year cycle with a clear terms of reference. We report directly into the CMOs. We've provided reporting into the North-South Ministerial Council. And the membership of that group is multi-sectoral and cross-departmental. So we would have membership from certainly Department of Health, but also some of the key agencies like Public Health Agency and the HSE, Department of Justice and Department of Communities. We have internal components where we make the space for safe conversations about challenging issues in alcohol policy. And we also have external facing components where we may have a public seminar to get to hear from international experts and to hear from people who are working on various aspects of policy development on alcohol. We embrace North, South and East, West inputs. So we would have had inputs from, for example, the British Medical Association and from Professor Ian Gilmore, based in London, from the Alcohol Health Alliance UK. So it provides an opportunity to bring those wider perspectives in to the work. Next slide, please. So I suppose this is a slide that talks about the various different levels of working relationships, from being completely parallel to being fully integrated, or from being shallow to deep, depending on which way you want to think about it. But I think we have to accept that some people will see this moving from lower risk to higher risk scenarios. There may be a higher political risk. There may be a higher risk in terms of transactional costs. There may be that you could equally well have lower benefit and higher benefit. But I think sometimes we've become overly focused on the risks and not on the benefits. The risks are more immediately clear, whereas the benefits are sometimes longer term and not as well articulated. So, and I think what happened within the pandemic was we had to move from shallow to deep incredibly quickly. And it's very difficult to move through these levels of working relationship very, very quickly. And that's been the challenge. We had probably been a little bit too much in the networking and cooperation sphere, and perhaps a little, and then moving from that almost into sort of a collaboration co-production space by necessity in the context of an emergency, public health emergency, did create a lot of challenges, which I know Anne will be talking about a little bit later. Okay, next slide. So just trying to be solution focused, I've listed some of the sort of the current issues that I would see as being priorities in relation to sort of North-South working on health going forward. At the moment, a lot of the work is still weighted towards that networking level, with the possible exception of the border counties where you see a deeper level of integration. And I think we can deepen those things through relationship, but we also need structures. And I think some clearly defined and boundaried operational frameworks would be extremely useful to move forward. The risk is, of course, that they will not attract any political priority, and that we will have a culture of maybe looking at the overt focus on the differences in the health systems at the expense of saying, well, we have the same health problems. We may have different health systems, but we have the same health problems, and North-South working continuing as a sort of optional extra. We do have fantastic examples of cooperation in border counties on health, but these have been very supported by European funding, and I think it's time to move perhaps to a more sustainable funding mechanism that's supplemented but not wholly dependent on European or third-party sources. Because when you have repeated short-term funding, you get challenges in bedding down and mainstreaming those really effective approaches or innovations that work. I think we have a lack of policy tools, which I think were talked about a little bit earlier in terms of perhaps that border proofing or better use of impact assessment, more integrated use of impact assessment in looking at, well, what will be the impact on health on the all-island basis, on a cross-border basis with this new reform. And a brilliant opportunity now to have more leadership networks between Public Health Wales, Public Health Scotland, the new Office for Health Improvement and Health Disparities in London, Public Health Agency and departments. Otherwise, I think we may see parallel paths, duplication of effort, and low system efficiency, and a system that's maybe not as resilient as it could be. Obviously, a key issue is you have to have a basic level of public health infrastructure as part of that resilience. And I think underinvestment in our public health infrastructure has been something that every country in the world is now come to realize, and that needs to happen as well. So there's a really good opportunity to build that up, but also build that up in a way that is much better equipped to address kind of transboundary issues. And what we have is something interesting at the moment where we have Sláinte Care and we have this future model for integrated care systems in the north that are actually heading in exactly the same direction, well, very similar direction, but taking rather different paths. So there is an opportunity in there to say both these health systems want to have integrated services. They want to have better care at primary, community and social care. They want population planning, and they want a better approach to addressing health inequalities. So I think there's a real opportunity there to say this reform is heading in the same way. How do we build that interface model to make it work really well in border counties? Okay, next slide. Health information systems differ considerably, and there's no amount of clever data analysis that can fix data that was collected and designed in different ways. So I think we need to really look at maybe some partnership structures between some of the higher level data collection, data management bodies, like the Office for National Statistics in the UK, the CSO and NISRA, to get away from this issue of poor data comparability. I'm a little concerned that with the UK withdrawal from the EU, that Northern Ireland and indeed the UK may lose relationship with the European and global information infrastructure and the assets that come with that. So I think that does need to be managed. And in terms of the financial viability of sustaining this increased demand for health service, obviously this is particularly acute at the moment in Northern Ireland, but we've not really done the health economics piece that well as yet in terms of where are the efficiencies, how can we leverage overflow arrangements, and so on. And then the workforce piece as well is critical in terms of we now realise we need a different public health workforce than we thought we needed 10 years ago. And how are we going to ensure that we have that flexible, multidisciplinary workforce fit for the challenges that that's in population health now? And my last slide, please. This is where I'm touching on UK withdrawal from the EU. Many concerns, but also some possibilities is what I'm pitching here. So I guess the main thing is in terms of monitoring impact and considering the responses specific to protecting public health. And the main concerns I would have, the initial concerns were really around access to medicines and so on. I think most of those issues have been resolved through a lot of hard work by the public health and the environmental health groups and workers, which went unfortunately largely unrecognised. But I think the broader macroeconomic piece is what would concern me from a population perspective, where we already have a very high level of food poverty and child poverty in Northern Ireland, and they are critical determinants of public health. So that does concern me. And again, this distancing in relationship from the European organisations that can support best evidence and so on. The other piece, which I've just mentioned here, is around law and regulation. It's a little unclear at this time what effect the Internal Market Bill may have or other trade relationships may have. We don't want to see agreements that increase the availability of unhealthy products or reduce the level of regulation or protection on those. But it's unclear to me, and I'm quite happy to be corrected on what level of autonomy Northern Ireland Assembly may have in introducing public health regulations, for example, minimum unit pricing of alcohol or safety standards in relation to food and so on. Those things are really very important. But, you know, within the ambiguities that are there, is there an opportunity for Northern Ireland to take its place and to be a leader in the state developing regulations based on evidence, local needs, and assembly consensus. Neither evidence, local needs, or assembly consensus are easy things to achieve, but I think that there is the scope within ambiguity to perhaps carve out something quite unique, and that is it from me.
Helen, thank you so much. Before we move on to Anne, just to pick up on, I love the phrase watering the good roots of public policy. But yeah, actually, one of the things that comes to mind is, and it touches on what Maureen was saying and actually what Aidan was saying, is watering the good roots. It depends at what stage you're watering those roots. If it was when it's a seed, as in ex ante, let's look at this before we introduce the policy or the legislation rather than when it's already introduced, and then we're trying to kind of rescue the plant and making sure that those roots are healthy. But thank you so much, Helen. Thank you so much for that. I'm now going to ask Anne to join us. Anne, you're very, very welcome. Very welcome indeed, joining us remotely as well. Whenever you're ready,
thank you, Anthony.
Just fire away. Thanks, Anne.
All right. Greetings from Dublin, everybody, and thank you so much, Anthony, and everybody in the Centre for CrossBorder Studies for inviting me to contribute to this really excellent dialogue. It's been so interesting. I've been tuning in for most of the morning and this afternoon, so thank you. I'm representing a study ultimately that was undertaken by the Discipline of Public Health and Primary Care and led by Catherine Darker. It was a contained toolbox with colleagues in a collaboration in Queen's University in Bristol in UCD, and a number of our own colleagues in our discipline, myself and Sarah Burke, Joe Barry and Emma Burke. And what we were particularly interested in is kind of quite opposite in a way to what Aidan and Maureen were talking about earlier on, which was looking at the impact on people's lives of the policies that were made along the border, and how that impacted on people's living conditions, on their tax arrangements, and the implications of stay-at-home policies at that micro or community and individual and household levels. What we were looking at, and what I'm interested in as an assistant professor in global health, is the nature of political systems, and how what very much what Helen was talking about, that really close relationship that exists between political systems, which are in fact the means through which the science of public health tends to be communicated and adapted and implemented in an environment. It strikes me, I think, and one of the things that really interests me in this field and in this particular subject in the context of COVID-19 was very much, if you engaged with many of the multilateral guidance that was coming from the World Health Organization and the European Centres for Disease Prevention and Control, they kept talking about and guiding on the science of public health, but constantly reiterating that it needed to be translated within the context of a political framework and the political reality of the local context. And I think that was very often lost, if you like, in translation. Next slide, please. So, as I said, it was part of a COVID-19 toolbox that was funded by the Health Research Board and the Irish Research Council, looking to disentangle psychological, behavioural, media and governmental responses. What we were interested in particularly, and our primary objective, was to study and track public health policy for COVID-19 in Northern Ireland and the Republic of Ireland across the timeline that captured the first wave of the pandemic only in each jurisdiction. And we did this using a range of policy indicators that had been developed by the Blavatnik School of Government in Oxford University. I come to some of this, again, with a global health lens, because, in many outbreaks, whether they be HIV or Ebola, SARS or Zika virus throughout the world, and through my work in the UN and for the Government of Ireland through the Department of Foreign Affairs and the Irish Aid Programme, looking at the political systems and how you translate the responses, the public health response or the infectious diseases response to an outbreak is hugely important in terms of how institutions and jurisdictions manage an outbreak of any disease worldwide. So it's nothing unique here, if you like. This is something that happens around the world. And in fact, political analysis of public health and infectious diseases outbreaks are recommended by the World Health Organization for every disease outbreak in jurisdictions. Next slide, please. I won't go through much of the methodology, but as I said, we use the Oxford COVID-19 government response tracker using data sources that were in the public domain. So the study is quite limited by the use of secondary data. It was also a very short, resource-limited study spanning over 6 months only. We used Irish Government and National Public Health Emergency Team data, Northern Ireland Assembly and Public Health Agency data, and SAGE and the UK Government. We used the Health System Response Monitor published by the World Health Organization to track and cross-check the sequence of events and triangulate all the data and information. So this was involved, as any policy study requires, and it's incredibly detailed, and requires reviewing an extremely large volume of documentation and applying secondary analysis. So we applied directed qualitative content analysis to look at measures, so next slide please, across 2 core areas of the public health response. This is containment and closure, containment measures. Sorry, next slide. Not sure what's happening there. Are we stuck?
Okay.
Thank you. Coronavirus. So the government response track provides for containment and closure policies and health system policies. I'm not going to go through all of these and our findings in each of the areas. I've selected 5 key areas that show where there was points of alignment and where the divergences also arose as well, and maybe perhaps explore some of the reasons why these happened through political economy analysis. Next slide, please. So the key here is Republic of Ireland in green, the Wales, Scotland and England in red, and Northern Ireland specifically. So tracking. So the first area that we looked at, all of the data, all of the political discussions and debates through Hansard, through Dáil debates, through all of the NEFIT minutes and the Public Health Agency press releases as well, and all of the data, was looking at the impact of school closures. What we found was that of all the policy areas, it was by far the most politicized and divisive initially. The first steps were taken in the Republic of Ireland following an outbreak in a school in North Dublin of one schoolboy who tested positive, and the Irish government on the 1st of March and closed schools, and subsequently 2 weeks later, less than 2 weeks later, on the 12th of March, closed all schools and universities in the state. Initially in Northern Ireland, there appeared to be a level of unity between both the Sinn Féin party represented, the First Minister and the Deputy First Minister, in terms of keeping schools opened. But after the announcement in the Republic of Ireland greater divisions emerged. Peter Weir defending his position, basically saying that it hadn't been politicised, that it was ultimately coming from the CMO, and Sinn Féin aligning very much with the Republic of Ireland position. And then you had piecemeal closures at community level, also along politicised lines or ethno-national lines as well. What's really interesting, I think, in this is if you step back and look at the guidance from the World Health Organization and the European Centre for Disease Prevention and Control at the time, they were actually advocating that schools and universities should not be closed. And the basis for this was based on a number of outbreaks of flu epidemics over many decades, and looking at the impact in schools and younger children. So thinking about that, what seems to have been the case, and again, we very often see this in an Irish context where the Republic of Ireland tends to be quite cautious and conservative in the way that it responds to public health measures, or any measures. There tends to be. We were also the same in terms of HIV, which is ultimately the area that I worked in for over a decade. There was a high degree of caution in the Irish government's response to HIV, and we saw this again in terms of COVID-19, that was deviating somewhat from the international guidance. Now, there was also a very interesting claim on the HSE's website, the Health Service Executive's website at that time, stating that Ireland was following the guidance from the World Health Organization and the European Centres for Disease Prevention and Control, but that due to Brexit, the UK was following its own path. Again, in our study, we did not find evidence to support that. Indeed, what we found was that the UK, after a significant time lapse initially, from February and the end of February, certainly began to follow the World Health Organization guidance quite rigidly as well. And that then played out in many of the other areas of policy development in the response to COVID-19 that tended to become very closely aligned. Next slide, please. Workplace closures, then again, what we saw here was, a lot of alignment arising in terms of workplace closures. But when you dig down into the details, some differences with the Republic of Ireland, work from home policies instituted from the 12th of March quite early, and piecemeal closure of very different venues between the Republic of Ireland and North of Ireland. As you can see there, the differences in the timeline in terms of mandatory closures of all workplaces in both the Republic of Ireland and North of Ireland is literally only a difference of 4 days. So many of these things in the public awareness, and I entered this study, I think, and we all did, and I think in many of the papers got a lot of kind of public scrutiny and debate that we wrote, and many people kind of saying, but we had such an impression that the Republic of Ireland was way ahead of Northern Ireland in many, and that was certainly the narrative at the time. But when we dug into the policy agreements, we didn't actually find that. We found very close alignment and a very close timeline. Next slide, please. Cancelling public events and restrictions on mass gatherings. I wonder, could I ask, is there any possibility, instead of seeing myself, I could just ask you to increase the yes, thank you very much, because I'm blind as a bat, so it's a little bit difficult to see the slide. Thank you. Cancelling public events and mass gatherings. Again, a few differences here in the detail. The European Centre for Disease Control guidance at the time was that mass gatherings should be cancelled, and all mass gatherings before the peak of that first outbreak was reached. The Republic of Ireland, of course, cancelled the rugby fixture on the 7th of March, but really announced that way too late, with many rugby supporters who'd already purchased their tickets to Dublin already coming. We know, of course, as well, that Cheltenham went ahead, and that was responsible for, really triggered and gained pace of a number of infections, both in Northern Ireland and in of new cases in the Republic. By the 9th of March, however, there was both the Northern Ireland Assembly and the Dáil both announced, the Irish government announced the cancellation of St. Patrick's Day on the same day. And what you see here is in terms of cancelling public events and restrictions on mass gatherings between England, Westminster, the Republic of Ireland and Northern Ireland is literally a day's difference in these, 26th, I think that's 27th and 28th of March 2020. Next slide, please. Lockdown, shelter in place policies. Again, these were all enacted and became mandatory pretty much on the same day. So the 23rd, it was announced. 27th, lockdown, shelter in place policies announced on the 27th, and in Northern Ireland on the 28th. Now, again, there were some differences there in terms of, distances that you could travel. But if you pull back, as policy analysis requires you to do, and the Oxford COVID-19 governance response tracker has been repeated in multiple countries throughout the world, and it's looking at these high-level policies and how they were aligned across jurisdictions. But it's important to say that I really take Maureen's and Aidan's point that when you look down at the detail of what was happening at the border, and indeed one of our other studies looking at the Twitter feeds, there were a lot of the Twitter data, and which again is sometimes problematic in terms of analysis, and carries its own levels of limitation and bias. But when it gives you a snapshot of what people are feeling and experiencing, many of the issues that Aidan and Maureen talk about the difficulties of working from home in a different jurisdiction, and that cross-border traffic, the disruption to that on a daily basis. And for example, in the Republic, where there was the limitation of 5 kilometres that wasn't in place in Northern Ireland, was particularly difficult for individuals. But pulling back from that and looking at the levels of alignment and whether or not there was likely to have been some dialogue, and again, this is kind of speculative to some degree, but then the level of alignment that we find makes it unlikely to have been just happen chance. It's important to state that there is also alignment with the guidance coming from the World Health Organization and the European Centre for Disease Prevention and Control in all 3 jurisdictions too. So while there was this claim in the Republic of Ireland that due to Brexit, only the Republic of Ireland was following the guidance, the multilateral guidance, and that the UK was no longer following multilateral guidance, that's not supported by the data that we found. Certainly earlier on, I think that might have been the case, but that certainly wasn't the case by the time the first wave gained traction from mid-March. Next slide, please. Face masks, again, you can see a little differences here with the Republic of Ireland actually being much slower than either Westminster or Northern Ireland to enact face mask policies. But when they were made mandatory on exactly the same day in August, 28th of August, across the board in all 3 jurisdictions. Next slide, please. Testing policy is where we fell foul of, the data, the poor data comparability that Helen has talked about. We gave a huge amount of time over to this, and trying to work through, some of the deaths, for example, or just focusing on deaths, or just focusing on incidents, because there had been a huge amount of discussion and dialogue around the number of tests being rolled out, but the way in which the data was reported, and also some missing data from the beginning, the first few weeks of the outbreak, and after the 27th of February, which is when the first case was identified in the north of Ireland, and the 29th in the Republic, there were cumulative totals released across different timelines by each health agency, north and south. So that made it extremely difficult to, and especially in a small study like this, where, you know, that we were on a very, very tight timeline, to actually really dig down and scrutinize that. So there was a point at which we had to, if you like, give up. So it did defy comparison, both in terms of mortality rates, in terms of incidents, and the level of testing. The pace at which guidance and case definitions changed as well was difficult to track, and local differences in interpretation and system capacity were also quite difficult, with missing data in both jurisdictions and both reporting then cumulative totals across different timelines. What was really interesting, I think, when we were really scrutinizing this, is the communication around testing. So there were a number of different recommendations made, you know, about 12 different recommendations around how testing could be conducted by the WHO, but they qualify it all the time, saying that, you know, local systems need to be factored in terms of capacity, in terms of the strength of the health system, the capacity of the health system, the funding available within the health system, and of course the political framework within the health system is operating. All of those qualifications tended to be left out by the critics of either jurisdiction. What was really, I think, one of the most compelling case studies around that was the cancellation, Northern Ireland's, you know, because initially neither Northern Ireland nor the Republic of Ireland were able, they had initially said that their intention was to provide community testing to everybody who was symptomatic. Now, as the outbreak gained pace, the eligibility criteria for that had to be increased. So to such an extent that Northern Ireland stated that it had to cancel asymptomatic community testing. And while the Republic of Ireland also did the same and issued the same guidance to primary care practitioners through the Health Protection Surveillance Centre, we actually didn't announce it. But it was announced in Northern Ireland that communities, but in effect, it was exactly the same thing. Now, as testing began to ultimately outstrip, if you like, resources, both throughout the pandemic, in all outbreaks, the first wave, second wave, and third wave, each jurisdiction had to increase the eligibility criteria. I think what happened in the critiquing and the communication by public health and individual critics of either system is that they commented on one system over another rather than looking at the systemic whole or the structure of whole. So it wasn't incorrect to say that Northern Ireland had ceased community testing. However, it paled into insignificance if you compared Northern Ireland to multiple other jurisdictions throughout Europe at the same time, who were experiencing this massive increase in the number of symptomatic cases coming forward daily and a limited health system capacity, and having to make a decision about what was possible. The Republic of Ireland did, you know, sometimes what I think we do quite well in the Republic is kind of keeping our heads below the parapet and, you know, not maybe broadcasting to the world. You know, Samuel Beckett says, you know, any fool can turn a blind eye, but who knows what the ostrich sees in the sand. If you keep a low profile on something, you know, you can get away with people believing that the initial statement we made around community testing still held. It actually didn't. We only resumed community testing from May.
Sorry, Anne, could you wrap up?
Sorry. Yes, I will. Sorry. Next slide there. So we also looked at the minutes of meeting from bilateral meetings using Hansard and reports through the Northern Ireland Assembly and Quad meetings, of course, as well, and minutes of meetings. And what we found was that there were weekly telephone conversations and very strong relationships between both the Republic of Ireland, the CMO in NEFIT, and Peter McBride in the Public Health Agency. And I know myself as well from working in health systems and as a civil servant that wouldn't be stated in a public document unless it was true. So that was repeated, and we triangulated that data search and found it repeated in multiple places. Next slide. So the overall findings, what we find is that public health and containment policy responses to COVID-19 in the Republic of Ireland were broadly aligned, including in the pace of their introduction. I've already talked extensively about the difficulties around testing. The 12th of March looms large in terms of what became the perception versus the reality in terms of what were perceived as differences. And many commentators jumped on that community level, the differences in testing strategies that were communicated in one jurisdiction and not in another. Hansard on departmental minutes point to regular weekly meetings and dialogue between each. There were significant points of interjurisdictional alignment between all of the policies that we reviewed. There's nothing unusual here. And I think that's, if anything, it's reassuring. HIV and AIDS, Ebola, Zika virus and SARS and COVID-1 were among many other infectious diseases across time and geographical distance illustrate the ways in which political realities and the capacity of a health system impact and impede the best intentions of public health experts. Next slide, please. You see some divergence, as I've already talked about there, in terms of school and college closures, workplace closures, but again, testing, the jury is out on that. Next slide, please. So barriers to an all-island response was really the politicisation of public health narrative, almost certainly exacerbated by Brexit and the issues arising at that time around the protocol. So COVID-19, despite all our fears around it at the time, and similarly with HIV in the 1980s, didn't really shift the political status quo. So we don't know what that tipping point would be, which would prompt, an all-island response. Of course, many people referred back to the single epidemiological unit concept that framed the response to foot and mouth earlier, but that was at a very different pre-Brexit time that has really changed, as a number of commentators throughout the day have noted today. It has changed the political context and the nature of political dialogue under the Good Friday Agreement. There is nothing new here. These kind of tensions play out in every disease outbreak, in every corner of the world, and disease, the spread of the disease, the political capacity of the jurisdiction, the nature of post-conflict in which adherence to public health policy outcomes or public health guidance tends to be significantly lower in post-conflict societies, and you see that playing out hugely in terms of Ebola and also Zika virus throughout the world as well, where there was low levels of take-up of public health guidance. That does happen, and it hasn't really been looked at in the outbreak of COVID-19. But what we found, and I think this is really the take-home message, substantial public health policy alignment brought about by ongoing dialogue and cooperation that was definitely hugely evident in everything we looked at between the health administrations in each jurisdiction, and that we found that provisions of the MOU were adhered to as they were provided for under the Good Friday Agreement. Final slide. That's it, I think. Thank you very much to all of you, and sorry for going over time, Anthony.
Thank you, Anne. Thank you very much. One of the things that came out strongly there, well, two things for me. It's perception versus reality in terms of differences and the impacts of differences in terms of public health measures. Now, I'm not necessarily saying it's the same in terms of supports for businesses and supports for employers, where differences there, even slight differences can have significant impacts, and the perception perhaps does match reality. So that's one of the things that came through there. But also the cooperation that goes on quietly and has been going on, and is perhaps people aren't necessarily aware of that. So as we're kind of slightly over time, I'm just going to ask each one of you a very brief question, and I would ask for a brief response if you don't mind. And I'm going to stick with you, and it's actually a question that's coming from the audience, and it gets to the heart of it, really. It's asking whether good cooperation, proper cooperation across the borders can help to control the spread of such kind of diseases like COVID-19. Is good cooperation going to help in terms of that? What would be your answer?
Absolutely. I would say the single most important indicator of disease prevention and control, in my experience in relation to HIV and what I know about the outbreak of Ebola everywhere in the world, is about political leadership. So that there, and I think this very small study, but nonetheless has shown very promising indications that high-level leadership, collaboration, and good relationships between civil servants on both sides of the border had resulted in alignment. What we can't say from this study is, what would have happened if you didn't have that. It might have been, we can speculate that it may have been much worse, but there were lots of, and while if you look at the detail, there are issues undoubtedly, there is no doubt, and the evidence shows us this throughout the world, that leadership is key, and high-level collaboration across borders is key for the control and prevention of infectious diseases.
Thank you. That's a theme that's run through the entire day, leadership, which is absolutely essential. And turning to you, Helen, you mentioned the fact that the Institute for Public Health supports public policy through research, providing an evidence base in terms of that policy, public policy north and south. But my question to you is this, when you're providing the evidence, is this ex ante? Are you providing that evidence base as the policy is being developed, or is it once the policy has already been developed and you're kind of providing evidence on its impact?
I think mostly we try, the earlier you can input evidence into the policy development cycle, the better, provided that people are of a mind to look at it and take it on board. And that evidence is transferable to whatever context it needs to go into. So we would respond to consultations on public policy. For example, we just recently did a consultation response on the mental health strategy in Northern Ireland, and we addressed all island cooperation and cross-border issues within that. The other way in which we try and build that health in all policies approach early on is to use health impact assessment as a tool to look at what can we reasonably think are the health impacts of this new policy, this new program, this new law, this new service. And that evidence is from evidence that's published in the literature, but also through engagement with local stakeholders to say, well, what's the impact going to be on you? What do you think? And to bring those pieces together and proactively say, if you want to design a policy that's better for health, here's some amendments you may need to make. So we are just finalising updated guidance for health impact assessment on the island of Ireland. And in that we have drawn a lot of inspiration from the health impact assessment work done by Public Health Wales and across the UK. So the earlier the better in terms of influencing policy. But the key is not just to provide evidence from the States or from Canada, but to provide evidence that will fit with the system that's meant to be using it. So
thank you, Helen.
Thought on that?
Yes, thank you. Aidan, in terms of the taxation issue that you're trying to, you and the CrossBorder Workers Coalition are trying to seek a solution for. What do you think is the little push that's needed? Because it doesn't seem to be in terms of financial costs to the revenue doesn't seem to be, as far as I can see, that significant. What do you think is that push that's needed to get you across the line?
So it's a great question. There isn't a financial hit. You know, we know that. We've heard that directly from the revenue, that it's not a concern about the finances side of things. The concern that they have stated, and it's very clear in the paper, is in around equity and competition. So the final push that we believe that's needed is to address those particular concerns, because they're almost intangible concerns, as it were. They're not strong enough, almost perception, if you like, in terms of what could happen. What we would like the government to do is be pragmatic in terms of what the art of the possible, to figure out what is innovative. They've already introduced like a remote working strategy for the island of Ireland, which is fantastic. But if it's not backed up by pragmatic, innovative solutions to resolve this particular issue, then it's just not going to work for a section of the Irish citizens. So what we believe a final push in terms of addressing some of those concerns. It may well be that a scheme of some sort that's time-boxed, that's got a control over it, a set of measures such as maybe limiting them to certain roles that doesn't invoke like corporate tax presence in the Republic of Ireland, or a salary threshold, or there's measures like that that can be put in place, and perhaps having the penny drop with the revenue, that they could put something in that can be retracted back if it is being exploited or if it is not working. But that's what we need. There's no point in admiring this problem if island economy. There's a vested interest there in the business community in all parts of the island, and also a final push from individuals who are actually impacted by this as well. They need their voice heard. There's no point in being quiet in this matter and being aggrieved that nothing changes. We need their voices heard at this particular juncture. It's really important the next couple of weeks that voice is heard.
Thank you, Aidan. And before I just ask a question to Maureen, I'm going to send people in the back room there into complete tizzy. But just to warn, I'm going to be wrapping up. I'm going to be making my closing remarks from where I am. So no formalities, please. As we are, I'll be doing my closing remarks. So I'm going to come to you now, Maureen. Aidan's here has been talking about looking for solutions, imagination, but in a cross-border dimension here. Do you think that, and I don't mean to this in any negative way, do you think that we, those of us who are involved in cross-border cooperation, particularly those of us involved in looking at policy and really at the methodologies around cross-border impact assessment, do you think we've been doing a good enough job of selling that idea of cross-border impact assessment as something that is not there as a negative, it's there really as something that can perhaps bring positives?
Yeah, it struck me actually, just listening to Helen also. She'd mentioned, it's not looking about the risks, it's looking at the impact. So it doesn't have to be a negative, it can be a positive. I think that it's probably a slow burn, and even when you think about rural policy or rural proofing, it's challenging enough even to do something like that, never mind, the concept of something in cross-border proofing. But there's great bottom-up demonstrations of where it works, and arguably what's needed is to maybe put some case studies forward, show where an impact assessment would work and how that fits into encouraging cross-border cooperation, whether it be economic, social. Environment is obviously a really key one going forward. There are projects and programmes out there that that kind of ex-ante approach to understanding impact is really going to be key going forward. The one thing I would like to end with is by saying, if you have something like a common travel area, and there's legislation and policy being introduced that actually challenges the whole concept of that, then almost that assessment has to be made on the common travel area itself, even as a starting point to say, if you're going to bring in something that actually challenges your ability for freedom of movement, then that in itself demonstrates that there's some kind of proofing of that legislation needed.
Thank you very much, Maureen. Of course. Thank you, Maureen, so much for that. I was just being reminded there that I was jumping the gun there slightly. So, Maureen, Aidan, Anne, Helen, I am so grateful to you all. I mean, that was really rich, a really rich conversation, enormous amounts of ideas there. And it's a positive as well. It's not. It was about options going forward and what needs to be done in terms of strengthening that idea of looking at things, looking at impact assessment from cross-border dimensions. So I'm really grateful to you all. Thank you so much. Thank you.
Thank you.
Thank you.
The Centre for Cross-Border Studies is unique in that it is an organisation which is clearly doing very important research into the impact of the border on our economy, on our society, and indeed on our political system as well. And that research has been hugely helpful to policymakers like myself when it comes to developing policies, particularly when we're looking at the impact of the border on the border regions.